I didn't know that. Yeah.
So, Lieutenant Governor, I'll introduce you to Zach. He's the Executive Director of the
Hi, Zach.
today.
Gentlemen, good to see you. Hey, everyone. Thanks for having us today.
Hi there.
How you doing? You had a good Christmas? All things considered. I had a lot of quarantine time. Now I'm a big But thank you all for having us. Hi, everyone. Good to see you, sir. Nice to see you, sir.
You can be honest, it's okay. I have some good ideas about that. Oh, thanks. It's just
Thanks, everyone.
thank you.
Pleasure to meet you. Thank you for this. I was just saying you never expected this mission, I know. So, but thank you. Pleasure to meet you. Thanks for being here. Nice to meet you. Nice meeting you. Yeah, thanks.
How long have you guys been on site?
We've been here since December 17th.
This is 17.
Yes.
Okay. Well, we are incredibly grateful. I was just mentioning that we were on the White House call today, and a lot of other governors have been asking and kind of talking to us about doing this and setting this mission up. This from the Good to see you.
Good.
Do you think we'll cross paths forever?
I don't know. It seems like
Feels
we're
that way.
so
I had hair when we knew each other.
Yes, sir. Yes, sir. That's all good.
We have
I'm
certainly
gonna go see you here.
Thanks again. I think it was Stillwater last time I saw you. We were at a testing site, so
Yes, sir.
the flexibility and the adaptability of the team has been great. I keep stressing and continue to stress it. This is not the way to come back. This is a triage situation. We are working as fast as we can to get folks in both on that side and then reduce the caseload in these hospitals. My good, had 1 million cases. The hospitalization rate percentage-wise is lower. The other ones under Delta was about 3.5%. These are about 2.9%. But a lower percentage of a much larger number is still a lot of hospital beds. That's what we're trying to explain to folks. It's still massive. But thank you all.
All right, whenever you're ready.
We're ready. Take back to a little bit. We'll be back.
Go this way.
We'll be right back. Welcome back, everybody. Good to see you all.
Yeah, you'll be the only staff.
Governor, I'd like you to meet my wonderful director of nursing, Gene.
Oh, pleasure to meet you.
Yeah.
Thank you. We know this is one piece of it. You know, some of the funding hires, civilian training. We need to make sure that the reimbursement model steady. All those things that need to fit. We appreciate it. Hi.
Lieutenant Flynn.
Yes.
Case the governor got questions.
You guys all good? Especially want to make sure my battery's good on my mic.
Oh, seriously?
Thank you.
Huh? Do you want to meet your son's boss?
Sure.
Maybe they will. I don't know.
I'm about the same height, right?
All right, Peter. Good. You're working on staffing shortages. Perfect event for you.
Thank you.
Yeah. Happy to
That's not really the whole story. Birds are free at the
I have a question for you. I'm just curious about And you're the vice president for healthcare operations, right? Governor, this is Jackie. She's the vice president of healthcare operations.
Thank you. Thanks for all you're doing here. And you just, I said I talked to the president. I know that we're trying to cobble this thing together every day. But we are so thankful. This work here is pretty well. And we'll keep going. I said we'll backfill with these civilians and training up. Then we need to fix this now. Make sure that the reimbursement models and everything works.
I've always watched from afar what Minnesota does.
I'm glad to hear that. And I think that has to be our, that's our. Thank you.
Such a blessing.
So we've got Governor, Lieutenant Governor.
Sure. Jan?
and Commissioner Malcolm, and then General Manager. And then Jackie, the vice president.
I think it's second.
Good afternoon, everyone. Welcome to Maplewood Care Center. First and foremost to our journalist friends here, welcome back and Happy New Year to you and a Happy New Year to Minnesotans. We're out here today for several reasons, and over the last couple of years it's become more apparent than ever that the Minnesota virtue of caring for your neighbor and showing that humanity was a top priority for folks. And to be out here today in a long-term care, transitional care unit in the midst of Omicron surge, this is the place you can get to see what Minnesotans really care about. And I'm here first and foremost to say thank you. Zach, thank you to you and your team for what you're doing. It was great, and it was a good tutorial on what's happening up there, of mentioning that they're getting referrals for transitional care from places they've never received referrals for. And I think you mentioned Bemidji and others, because they're just in short supply. And these were after we stood up some of the extra ones. In a normal situation pre-COVID, they were saying all their beds are full upstairs of people moving out of the hospitals, moving into transitional care, and then moving home after rehabilitation. They're not full now because there's no staff to work them. And so the staff that's here is continuing to keep things going. And when I say staff, That's the nurses, that's the dietitians, that's the physical therapists, that's the food service staff, that's the custodial staff, everything that makes a facility like this work to provide quality care and dignity to the residents. That is all still happening, but it's becoming much more difficult. And that lends us to the next thing that we put into play, and I'm here to give a big thank you, the move to train Minnesota National Guard personnel as CNAs to be able to come and to fill this gap. We started that in November. There's over 500 who have received the training, and this is a facility where they're placed and doing the work. And for those who are here and listening to this, come from all walks of life. We've got pilots here, we've got soil scientists here, we've got full-time technicians in the Guard. We have a plethora of skill sets, but to train to do the CNA, to put your own family on hold and to come here and serve is the epitome of that selfless service we talk about. But I'll have to say, listening to the residents upstairs, the gratefulness they have. So General Menke, I thank you. I know Lieutenant Colonel Dowdy's here, and we cross paths at testing sites and everything. The Guard has been asked to do a lot. They're still continuing to do it, and they're doing it with professionalism. They're doing it with care, and to listen to a resident say, I know I shouldn't name names, but Nikki is the best. And she was talking about the lieutenant of highlighting that. That's what this is about. We knew this was coming. We knew that there was going to be a staffing issues as COVID started to run, and we started planning on this based on Delta. We're now in Omicron. I was on with the White House today, and the folks at CDC, they're estimating about 95% of the cases are Omicron. And what we've seen is where Delta would indicate about 3.5% of the cases would maybe receive or need to have some form of hospitalization. The numbers are lower with Omicron, which is a good news thing. They're down, I think, Jan, you know this number, 2.8 or somewhere around there. But as Commissioner Malcolm pointed out, 2.8 of a lot bigger numbers is still a lot of beds, and the same issue we're having in terms of not being able to move people out of the hospitals into transitional care and back home, and not being able to do that because a large number of staff are starting to see that they come down with Omicron. The good news is, and I will continue to make the case on this, if you're vaccinated and boosted, your chance of ending up in the hospital is incredibly small. If you're able to, and this is one thing the state, we announced today again, one of the things that we know slows the spread of this is if you know you've got it. And I can tell you this from personal experience, what starts out as a sore throat and a little bit of sniffles and a backache, assume in the environment we're in that is Omicron. Get a test, find out. And the reason that's so important is the sooner you find out, the sooner you're able to isolate, and the sooner we're able to break that chain of spread. And we saw it in my family preparing to spend Christmas with my college-age daughter, my mother, some of our family. We tested positive right before that. We isolated. They were able to not get infected. They were able to test negative. We didn't spend Christmas together, but I would say this, my 87-year-old mother is healthy and happy and did not get infected by this. And again, she's vaccinated and boosted, but we know that there's still breakthrough cases that come with these volumes. So I just want to say how grateful we are for the work that's being done here, how grateful we are for the model in Minnesota, as we were just discussing, that not all states are created equal in how this is done. And on the call today, and mentioning with General Menke, we have the most expansive use of the Guard in this model. It appears to me like every other state now with Omicron is hustling to get there. They're picking up this model. They're starting to train. With that, I would give a big thank you to our trainers who trained our folks from the National Guard to get that up and going. Listening to Zach and the team here saying the professionalism and the skill set that they came with was top quality. It's serving our residents and our citizens the way they need to be. And then just a reassurance to our Guard members. We are working and training up the civilian force behind this. 1,000 folks are being trained. The goal is to try and have them done by the end of January, because this is a temporary triage solution to a much longer problem. And then, once we get through this current situation and this triage, the discussion that we need to have is how do we make sure this model of long-term care and transitional care is a model that works into the future post-COVID. And so there's things that are happening, 1.8 million tests going out to school-age children and their families. We're opening up 3 new testing sites that will open up in the coming days. I think we're Anoka, Coon Rapids, and North Branch should be up sometime next week. We know Minnesotans experience some wait times at this. I think it's important to note that we will do everything possible, and we have the capacity to expand, which we built last year. It's going to take us a few days, and there are going to be times with the number of tests we're giving is an all-time high. There are going to be some of the delays, but we're making structural changes. One of the things I heard today, and I appreciate Commissioner Malcolm thinking of these things, in one of the test sites, you needed to wait the 15 minutes to get your results, and what that ended up doing was getting people to congregate in a place we didn't want them to congregate. So now we're making sure, like so many of these, you're able to get your results in the 15 minutes by text to know where you're at. That just makes decisions a lot easier. It moves people through faster. It cuts down some of that congestion. Those are things that we'll continue to build on. So just incredibly grateful, and grateful for my partner here. It's good to see you back again, Lieutenant Governor.
Thank you.
Good to see you.
Thank you. Well, good afternoon, everybody, and thank you so much for having us here. And just again, want to express my incredible gratitude to the Guard for stepping up and answering the call when Minnesotans really needed you. You're used to that. That's what you do. But we are so incredibly grateful. As we're making the transition back to school and back to work for a lot of folks, some going back yesterday, others today, I know that there are concerns. Certainly, as I send my third grader off, right, we are balancing making sure that she gets a good education, is able to be in school, with our concerns about COVID-19, which is why we're here to just reiterate the message that so many of you heard before, but it bears repeating. We need folks, if you suspect that you are ill, to get tested. As the governor said, we expanded capacity. There are a whole host of resources available through MDH where you can find these community testing sites, and want to encourage you to go ahead and do that. The vault tests are also available. That cap has been lifted to provide additional testing opportunities for folks to keep yourself safe and to make sure that you're not spreading COVID to others. The other piece is to make sure you are getting boosted. If it has been a few months and you are ready to get that booster shot, please go ahead and do so. As the governor said, it offers that additional protection and that it was needed and necessary. And we know that very soon our 12 to 15-year-olds will be able to be boosted as well. And then finally, if you feel sick, to please stay home. Right now, it is the season of RSV and colds and strep. And so if you are feeling ill, please stay home and don't spread it to others. Our hospitals, it's a very fine balance, as we said, for that capacity, and making sure that we are staying safe and protecting ourselves and protecting others is one of the ways that we care about each other as Minnesotans. So we're back in it, and we are stepping up. Grateful for the Guard, but also need to count on each other to do the right thing, get tested, get boosted, and please, please stay home if you are sick. And with that, I will introduce Commissioner Malcolm, who's been on the front lines and managing all of this for us. Commissioner?
Thank you, Lieutenant Governor. Well, good afternoon, everyone. Welcome to 2022. We have reason to hope that 2022 is more like the year that we hoped 2021 would be, with more tools available to us to deal with COVID and to really kind of get back into normal operations within, certainly within our schools, our businesses, our healthcare systems, our public health systems. We all look forward to the time when this is a disease that we believe is going to be with us, but we can manage it. It's an endemic, it's not a pandemic. And we feel that we are getting closer to that time, but here we are with a COVID wave again due to the Omicron variant that I think came faster and is much just more in volume all around the world, largely at the same time. There's a little bit of variation, but the challenge that this poses to us now is the sheer numbers of cases. CDC folks started saying a couple of weeks ago that they thought in the first week of January the United States would hit 1 million cases a day. That was yesterday. And what we're seeing in other states, other cities, other countries is the speed with which the growth curve literally goes vertical. We think we're just at the beginning of that here in Minnesota. And unfortunately, we're starting from a high level of cases already and very, very full hospital systems and long-term care systems because of the prolonged Delta wave that we've had. So primarily, I think I just want to be a resource for questions today, but it also gives me a chance to say thank you as well, certainly to the Guard, who have been incredible partners. Every new problem, they've been willing to help us address. But I also want to say thank you to the healthcare workers in acute care, certainly our hospitals and clinics, but in long-term care. Facilities like this, as well as in the broader community. Our healthcare workers have just been through something that's almost unimaginable, the sustained amount of pressure for 2 years now. And it's frankly no wonder that they're tired and really, in many ways, without exaggerating, at the breaking point from a health perspective and from an emotional perspective. Those of us who've been in this have had to help people deal with just incredible amounts of loss, and especially when we know that it is so largely preventable. It's truly heartbreaking. So for the governor, lieutenant governor have explained it well, and the way that all the pieces of the healthcare system need to work together. The hospitals rely on the ability to move people out into long-term care facilities. The long-term care facilities rely on hospitals being able to take their patients or their residents when they have need of acute care. And so when there are staffing pressures in one part of the system, it just sort of exacerbates and builds on the staffing pressures elsewhere. So we're here today to thank our healthcare workers and our National Guard partners. There are currently 14 teams of National Guard trained nursing assistants and technical assistants in facilities. There are 14 that have completed that mission, and there are more kind of facilities requesting this kind of help every day. So we know that the Guard's help is going to be essential in these next few weeks when we frankly are expecting the next round of challenges. And as Governor and Lieutenant Governor have said, the good news is we know how to respond to these challenges and these waves. This is a different situation than it was at the beginning when we really didn't know what we were dealing with. We didn't know what worked. We now have vaccines, and we know the power of things like simply wearing masks. And so our healthcare workers who have been there every day for all of us for 2 years now need us to be there for them. And you've heard us talking, and we're just going to talk about it a lot more in the coming weeks as the capacity pressures get even greater, which is hard to imagine. But our communities need, our healthcare workers need our communities to be there for them as they have been there for us for these last 2 years. So all the things that we've been encouraging Minnesotans to do, and we're grateful for the way that Minnesota has responded to getting vaccinated, to getting boosters. We also need to keep, in addition to those critical things, getting tested, relying on the infrastructure that we've built over these last 2 years, but understanding that we come into this Omicron wave, as the governor has said, in a better position than many. But even our robust infrastructure is going to be taxed by just the sheer volume of cases we're going to see in the coming weeks. So all the more reason why we need all Minnesotans to be vaccinated and boosted, to test, to stay home when they're sick, and to wear masks indoors, and to just be mindful of how very easily this is transmitted, and do what we can to minimize that. So with that, pleased to introduce one of the leaders from the Volunteers of America, which is the organization that supports so many of these facilities.
Thank you. Good afternoon, everyone. My name is Jackie Nickel, and I serve as the Senior Vice President of Healthcare for Volunteers of America National Services. Volunteers of America National Services, our healthcare division, is located right here in Minnesota. Our organizational home is in Alexandria, Virginia, but Healthcare for Volunteers of America started here. In fact, it started right here in this building. This was our first nursing facility that we opened with Volunteers of America. So it's fitting today that you are here. And I want to thank you, Governor Walz, Commissioner Malcolm, and our other distinguished guests. Your presence here lets us know that we're not alone. Sometimes we felt a little bit alone during these last 2 years, but we're not. One of the blessings, if I could say that, of the pandemic, it has brought us together in new and creative ways. To have these gentlemen who, I think all of them raised their hand when I said, do you have any healthcare experience before this? No, not one. But they've come together and partnered alongside of us, and your work is deeply appreciated. And on behalf of Zach and the team here at Maplewood and Volunteers of America National Services, thank you. A big, heartfelt thank you. Our work here is not done. I was talking to the governor a few moments ago, and while we are moving through this time of crisis, we have a lot of long road ahead of us, and the work is not done, and we must address the needs of long-term care and post-acute services. And I'm so thankful that Minnesota has always taken such good care of our elders and has done it in creative ways and innovative ways. And I appreciate being in Minnesota during this crisis. We absolutely must work together to compensate these employees for the critical work they do and the complex work they do with the respect they deserve. We must work together to lift up this incredible workforce. We must attract more individuals to this work so we can continue to provide the necessary services for our older adults. Thank you.
Thank you, Jackie.
General Menke?
Thank you, Governor. Hey, I just want to keep it real quick. First and foremost, it's an honor for me to be the commander of this professional organization, Minnesota National Guard. And the soldiers that are with us today and the soldiers that are in the other 13 facilities that Commissioner Malcolm mentioned are doing a professional job caring for our residents of Minnesota. So it's a partnership. You know, we worked with the Minnesota-State schools to train our soldiers and airmen rapidly, 75 hours of CNA training to get them the skill set so that they come into these facilities and do their training. And then they came and they executed, partnering with the homes, the facilities themselves, as well as other organizations in the state. So hats off to you. I'd be remiss if I didn't thank the family members and the employers that support these great Guard men and women, as well as other partnerships that we have in the state that have made this available for our soldiers to come in and do what's needed. You know, we're working in the community which we live in, we work here, and we serve here, and we continue to do what's needed in this time of need. Thank you.
Thanks, General Menke. General Menke will never say it, so I'll say it for him on this too, is that at a time when we've used the National Guard in missions that stretched literally around the world, domestic missions here at home, and then COVID, and during that time, they've still been able to recruit and retain. There was only one state that recruited more folks, raw numbers of folks into the National Guard, and that was Texas. They're a little bit bigger, and they barely did more. And that speaks volumes to the type of folks who are still signing up, and they're seeing the op-tempo of this, and it's hard. These are folks that have their own families, their own civilian jobs to do, their own education and other things they want to do, and they put that on hold to serve us. So once again, I would say this, and I appreciate Jackie you saying so. Minnesotans have come together. We've got some more work here. I share with Jan, I was hoping, I mentioned at one time when we got in the fight of this thing last year that we were doing a goal line stand, and we held and went back. They came back again. I don't think COVID cares that we're tired. It doesn't care that we're sick of masks. It doesn't care what it simply is infecting folks. And what we know is, as Jan said, and we all know, we've got the tools now for the most part to prevent the most serious illness. We have the potential and the capacity to be able to protect this workforce, and we have the capacity to make sure we turn the corner on this, as Jan said, and get to more of an endemic state. We need to do all this, and what we're doing now is we need to keep educating our children. We need to keep our businesses open, but we need to make sure that we don't overwhelm the system, and that takes all of us. These folks raise their hand and they're out here, but if you want to help the Minnesota National Guard and our healthcare workers today, get vaccinated. Get a booster, and if you really, really love the Guard and you're happy with what they're doing, wear a mask, a little extra there on that. That would make a difference and make their job easier, because if we don't have to have that big wave coming out of the hospitals, we can send these folks back to their families, back to their jobs, and deactivate them, and that's what our goal is as quickly as we can. So with that, I'd be glad to take some questions.
Governor, the frustration of the last couple of weeks
with people not being able to get at-home tests and the long lines at the state facilities. Was the state involved, caught off guard by what the demand would be?
No, I think, in fact, if you go look, and I've been on the call this morning with the other governors, the situation is across the country, and in fact, it's globally. I'm still frustrated that we didn't do more over the last year, but the state of Minnesota did. The demand is way up. As I said, we delivered 1.8 million. We were able to secure and deliver out to our schools today. We knew it was going to be tight, and just to be candid, when the federal government started to pick up on this and said, if some states aren't going to do this, we're going to do it for them, and the federal government requisitioned 500 million tests, well, that had to come from somewhere, and it came out of our allotment in some cases, because we had already gone out there and started to contract. We're a bit back into that situation we were early in 2020, where we were competing against other states and and the federal government. The good news is, for Minnesota, your access to testing and free testing, there's states right now that are just now doing the free testing or the mail home tests. Those are available. I ask Minnesotans just a little bit of patience here. You should see a few more days before we get these other sites back up and running, and that should alleviate some of it. But it is still going to be hard, and I think, you know, Commissioner Malcolm and her team are doing everything they can, but we do need to be realistic. We're going to see more people requesting tests than at any time during the pandemic.
So that there is a reality factor there, that we are going to continue to work as hard as we can to use every one of these assets that have been built up over the last 2 years. We come into this with
troops. We put $50 million out in December to help long-term care facilities with their hiring and retention as a start. I think you're going to see in